to start with the shoulder joint. So we're doing a shoulder abduction, which is an upper lateral movement of the humerus in the frontal plane. The muscles associated with this movement are the supraspinatus, which stabilizes the humeral head, the deltoid, which uses the anterior fibers to flex and internally rotate the humerus, the upper pectoralis muscle, as well works in association to make this movement happen. As a result, the shoulder girdle also creates movement as well and it moves in an upward rotation and elevation. The muscles associated with the shoulder girdle are the rhomboids, the serratus anterior, the middle and lower traps, and the levator scapulae. So moving on to the shoulder girdle. The shoulder girdle is a scapula abduction. The scapula moves laterally away from the spinal column. As well, this movement creates a lateral tilt within the scapula. It rotates on its vertical axis, which also creates a posterior movement of the medial border and an anterior movement of the lateral border within the scapula. The muscles associated with this action are the pectoralis minor, which is an anterior muscle, and it draws the scapula forward and also tilts the lateral border away from the ribs. The serratus anterior is a posterior and lateral movement that draws the medial border of the scapula away from the vertebrae. And the subclavius muscle works in assistance in the abduction of the scapula and the shoulder girdle. As well, it also protects and stabilizes the sternoclavicular joint.